Bernardo is in a meeting. He will do his best to join us as soon as possible. So let's launch this event. Excellencies, dear colleagues, it is with a certain emotion that we are welcoming you today for this last Geneva Beat Plastic Pollution Dialogue before the world meets in Busan for what is expected to be the last round of negotiations to develop a legally binding instrument to end plastic pollution. We have launched this series of events at the end of 2020. 1 year later, at the closing of a ministerial conference convened in Geneva, to which we are grateful that our colleagues from UNEP also associated us in a way to that conference, Peru and Rwanda submitted a draft resolution for consideration at the United Nations Environment Assembly. This historical resolution was then adopted in early 2022 by the Assembly and set up the path to the ongoing negotiation to develop a global treaty to end plastic pollution. We have addressed health in various sessions of these dialogues, and so much evidence on the health impacts of plastics has been identified since we started. Let me remind you that this series of dialogues making links with ongoing multilateral processes to tackle plastic pollution in Geneva and beyond is organized by the Geneva Environment Network in collaboration with the Basel, Rotterdam and Stockholm Convention Secretariat, the Center for International Environmental Law, the Global Governance Center at the Graduate Institute, the International Union for Conservation of Nature, the Forum on Trade, Environment and the SDGs, the University of Geneva, and the governments of Norway and of Switzerland. The Road to Busan series of events organized as part of the Geneva Beat Plastic Pollution Dialogues in collaboration with various partners has provided member states and stakeholders a platform to prepare for the upcoming negotiation by launching new reports and initiatives and hosting briefings and discussions, providing tools for a timely outcome of this very important negotiation. You are attending today the 14th dialogue that we have organized since the last INC meeting. Today's event is organized with the World Health Organization, the International Pollutants Elimination Network, known as IPEN, and Healthcare Without Harm, to discuss health aspects of the treaty under discussion. Before you are formally welcome, let me remind you that the documents presented, the summary, as well as the video of the event will be made available as usual on the webpage of this event. Throughout the event, you can raise your questions by using the Q&A box. We will use this to feed the discussion during the Q&A session. There are slides now on the screen that show you how to access the Q&A box. And I would also like to add that the transcript is also available in over 100 languages, as indicated in the upcoming news slide. So now to formally launch this event, I am pleased to turn to Ms. Damaris Carnal, who is the Deputy Head of Section at the International Affairs Division of the Federal Office for Public Health of the Government of Switzerland. Damaris will be moderating and chairing this event. And Damaris was indeed at the United Nations Environment Assembly when this negotiation was negotiated and adopted. So with that, Damaris, the floor is yours.
Thank you very much, Diana, and good afternoon, good morning, or good evening to all participants in the room and also online. It's really a privilege to be here just a few moments before the start of INC 5, where the international community will need to take decisive action to end plastic pollution. But before saying a bit more on our engagement from a health ministry perspective, I want to first give the floor to my colleague Amanda from the Ministry of Environment. Amanda, you have the floor.
Thank you very much, Damaris, and also to Diana for the introductory remarks. And well, good afternoon or good morning, good evening, colleagues. It's good to be here. So first of all, on behalf of Switzerland, I would like to thank the Geneva Environment Network for hosting this webinar on the health aspects and the ongoing negotiations for an international legally binding treaty to end plastic pollution. We all know plastic pollution is a multifaceted challenge, and to achieve the goal of protecting the environment and also equally human health from plastic pollution, we need to join forces. As we all know by now, ahead of INC 5, the chair has published a non-paper, and this non-paper is proposed to be a basis for the negotiations at INC 5, also with the aim to provide us guidance and support member states to focus the text on essential elements, and with that to be able to conclude negotiations in Busan. And in view of the upcoming negotiations, Switzerland has, together with Ethiopia, Georgia, and Ghana, and also the WHO as other stakeholders, developed an information document on plastic pollution and health. And this document will also be posted on the GEN website. And the purpose of this document is to provide the INC with better information on the potential human health impacts associated with plastics, including plastic pollution. And the aim of this document is to strengthen the public health aspects in the treaty. So the delegations that are interested in supporting this document can contact any of the delegations that have provided this document. Currently, member states cannot yet publish information documents on the INC website, but we will do so once the INC begins. So all member states and their respective delegations at INC 5 are encouraged to support a health protective treaty to end plastic pollution. So with that, I will hand back over to my colleague, Damaris, to talk more about the importance of a One Health approach in the plastics treaty. And thank you very much.
Thank you very much, Amanda, and thank you also for mentioning the paper. I think when we were discussing, and I have to say it was also our first joint action between Ministry of Environment and Health to develop a paper, because we realized that health aspects were not sufficiently taken into account in the treaty, be it in the zero draft compilation, or now also in the chair's paper. It's true that health was always mentioned as a core objective, that we need to protect not only the environment, but also human health from plastic pollution. But we felt that it was not clearly understood that health components need to be contained in all relevant obligations throughout the plastic life cycle. This is why we have decided, together with the Ministry of Environment, to try to raise the profile. We felt that it was also one of the reasons why health aspects were probably not sufficiently taken into account in the negotiating process of the plastic treaty, was also because as often we tend to work in silo. And it is also clear that sometimes the health community and the environmental community, also for some good reason, also resource reason, tend to work in their own communities. So this is why we're very happy to try to put this kind of One Health approach in action, and also to work with other partners. We were and we continue to remain strongly of the view from a Ministry of Health perspective that it's not sufficient to have one article in such a treaty on health. It is, of course, important. It needs also to be strengthened and binding, but we need to make sure that if we want to have a health protective treaty, it's contained in the objective. It's also linked to reduction of plastic production, because we know that it's not currently sustainable, and we need to put all measures in place so that plastic products on the market are also safe to health. And this includes, of course, transparency requirement, phasing out and banning of harmful chemicals, and also disclosure obligations from the private sector. So we have tried to also include this in the document that was just mentioned. We're also here to respond to some questions. But in order to highlight this, we also have the privilege to have shortly with us, but he will be on video first, someone who has also been instrumental to the negotiation. And this is Bernardo Rocarrey, who's the chargé d'affaires of the permanent mission of Peru here in Geneva. I think we can safely say that Peru has shown outstanding leadership on environment and health issues. They have been coherent across all organizations, also here in Geneva, also at the Human Rights Council, trying to break the silos and try to push for ambition. And on a more personal note, I had the privilege also to be in Nairobi, as was mentioned by Dinah, with Bernardo when we finalized the mandate for this treaty. So I'm happy that now we can hear more from Bernardo directly.
Thank you very much, and good afternoon, everyone. I would like to begin by thanking the organizers for this timely briefing, as we are just a few weeks away from the 5th round of negotiations for the future instrument to address plastic pollution in Busan. At this pivotal moment in the negotiation process, galvanizing efforts to strengthen the health aspects of the future plastic treaty has never been more critical. I should begin recalling that Peru has a long-standing commitment to tackling plastic pollution, both domestically and in multilateral forums. Alongside Rwanda, and supported by a broad coalition of countries, Peru led the historic UNEA Resolution 5/14, which launched the process to develop a legally binding instrument to end plastic pollution under the framework of the INC. Peru had the honor of chairing the first 3 INC sessions, and nowadays continues to serve on the Bureau. Peru has also been actively involved in raising awareness of the health impacts of chemical pollution, both in the INC process itself, as well as in the WHO, with the submission of World Health Assembly Resolution 76.17 last year on the impact of chemicals waste and pollution on human health. In this regard, Peru's commitment to advancing multilateral efforts to reduce and ultimately eliminate plastic pollution is nothing new, and we have been calling for the future plastic treaty to address health aspects in a transversal and cross-cutting manner. Indeed, protecting human health and environment from the adverse effects of plastic pollution must be the central objective of this treaty. In addition to reducing plastic pollution, the treaty offers a crucial opportunity to manage the harmful chemical components of plastics and mitigate their potential health impacts on society. It is equally important that the instrument establishes and clearly outlines binding obligations for all parties on key issues such as plastic products and chemicals of concern, covering the entire life cycle of plastics. Concrete provisions that are fundamental for an effective plastic treaty includes a mechanism to regulate chemicals of concern, employing both negative and positive approaches for listing chemicals, as well as promoting chemical simplification. This will include specific provisions to prohibit and phase out the use of certain chemicals, group of chemicals, and polymers of concern in the production of plastic polymers, plastics, and plastic products. In this regard, the original draft of the plastic treaty, prepared by the Peruvian chair, Ambassador Gustavo Mesa-Cuadra, included ambitious language on plastic products and chemicals of concern from a health perspective. As you all know, today, plastics are ubiquitous, used across a wide range of sectors. While many of these applications bring significant benefits, plastic can also pose serious risks when improperly produced, used, or disposed of, particularly when they leak into the environment or are mismanaged as waste. Recent studies have revealed that over 16,000 chemicals are involved in plastic production, and a substantial proportion of these substances have hazardous properties that raise significant concerns for both human health and environment. It is now known that microplastics are present even in our bloodstream, yet the full extent of their impact on human health remains uncertain. However, it is highly likely that the effects will not be beneficial. Despite growing evidence that certain chemicals used in plastics are harmful to both human health and environment, there is still a critical need to deepen our understanding of these risks and expand public awareness of the issues, particularly when plastic products are improperly disposed of or contribute to pollution. More specifically, future research on the links between plastic pollution the chemical components of plastics, and their impact on human and environmental health should be developed. In this regard, the WHO has extensive expertise in assessing risks and benefits to human health and should play a key role in developing the criteria and evaluation methodologies needed to determine and prioritize which plastic products are considered problematic and avoidable. Lastly, I want to emphasize the critical importance of raising awareness about the harmful impacts of plastic pollution on human health, human rights, and environmental protection. We must seize the political will and momentum building across international fora to tackle pollution, which is one of the defining challenges of our time. Peru will continue to advocate for an ambitious INC process, striving for a treaty with a strong health focus that actively promotes the reduction of plastic pollution. Our goal is to secure a truly impactful agreement that addresses the full scale of the plastic crisis. Thank you.
Thank you very much to Bernardo and to Peru, and I shall not continue here without acknowledging another country that is leading by example, and another friend that just entered the room. I want to mention Ecuador. It is, of course, they have also demonstrated incredible leadership all through the current chair, Ambassador Luis Vallas, and we're very confident that we're in very good hands for the pursuit of this process. But I think after this opening from Bernardo, I think we have now a good basis to continue our discussion this afternoon. We'll have two panels. The first one will give us a bit more of a setting the scene on why it is so important that we take into account health in the context of the negotiation of the treaty. We'll then have case studies to make this a bit more concrete. And then the second panel will also be dedicated and going into a bit more detail on what do we mean concretely by having a health perspective in the treaty. But to start off with this first panel, we have Leslie Onion, Melchior Kuo, and Sarah Dunlop, respectively from WHO, IFPMA, and the Minero Foundation, that will each give us their perspective. And we will start by the WHO, and you have the floor, Leslie.
Thank you, Damaris, and thanks to the GEN Network for the invitation to join this discussion this afternoon and to highlight these important issues. So I wanted to run through what WHO has been doing in contributing to the discussions at the INCs and beyond. And in doing this, we've really established three key guiding principles. And these principles have the objective of strengthening the public health aspects of the proposed treaty. Firstly, we must recognize that we need to pursue the highest attainable standard of human and environmental health, and that this really needs to be a core objective of the treaty. Secondly, we need to recognize that plastic pollution creates or contributes to health hazards, risks, and exposure to all stages of its life cycle, and including the nanoplastics, the microplastics, and also the chemicals that are found within the plastic. And thirdly, that we need to ensure access to safe and effective health products that are of good quality and are affordable, accessible, and appropriate to those that need them. In advocating these principles, we've held a number of dialogues with the health sector. We've made submissions to each of the INCs, and we've held a number of information sessions with member states, including last week, where we were pleased that we had a very strong representation and interest amongst the health community. And many of the speakers that you'll hear from this afternoon contributed to that recent health information session. So just to delve a little bit deeper into these principles, the first one of the pursuit of the highest attainable standard of human and environmental health. If I could, in the pursuit of this objective, we're very much guided by the World Health Assembly resolution that Bernardo mentioned of last year. And in this resolution, the 194 member states that make up the World Health Assembly voiced their concern on the impacts of chemicals, plastics, waste, and pollution. So this gave us a very strong mandate for for strengthening and scaling up our own advocacy of the area. Primarily, we also recognise that health and environment are very much interconnected, and this is reflected in the One Health initiatives, which are increasingly part of our work and our response to climate change. We also need to recognise the human rights that we have to a health and also a clean, healthy and sustainable environment. We recognise that there is an overarching imperative to act on upstream determinants to promote and protect health. So it's not sufficient to put in place end-of-pipe solutions. You really need to have upstream efforts. The importance of information and transparent decision-making based on the best available evidence, that is very core to our mandate in many areas, or in all our areas. And then again, the role of WHO and existing expert bodies, the guidance that we're involved in producing and the associated expert processes, all of these will help us to achieve this objective. The second objective is that plastics pollution and health aspects are being increasingly recognized. So we know that production and use of plastics fundamentally contributes to the triple planetary crisis that we're facing: climate change, biodiversity loss and pollution, particularly in the production of plastics and the greenhouse gas emissions that are associated with that. We also know that the impacts of plastics on health disproportionately affects people in vulnerable situations, notably children, workers, including those in the informal sector, and patients that are receiving healthcare. The body of scientific evidence continues to grow, particularly about the chemicals found in plastics and on the impacts of micro and nanoplastics. So it's not just a waste issue. And we recognise also that there are considerable co-benefits to be obtained from addressing problematic single-use plastics, which also don't contribute anything to health. And an important example of this is the plastics found in cigarette butts. Now, cigarette butts are the most littered plastic item on the planet, and there's no health or an environmental benefit associated with them. And finally, the use of plastics in healthcare. Plastics are used very widely in healthcare, including in clinical and non-clinical settings. And important examples are medical devices, packaging of medicines, and the use of plastics in the development and manufacture of health products. There are more than 10,000 types of medical devices existing, and these range from syringes to nuclear medicine scanners. There's a very wide range there. So we recognise the important role that plastics play in healthcare, but at the same time, we recognise that plastics can be detrimental. We've already said that plastics can be detrimental to health. We also know that plastics comprise more than 30% of all healthcare wastes, and that globally, healthcare facilities really lack the capacity to segregate waste and deal with it correctly. So this is really a recipe for disaster if we don't take measures to curb the use of plastics but this needs to be done in a very thoughtful way. The report that's illustrated on the slide here about what happened to healthcare waste during the COVID-19 pandemic really illustrates very important lessons that can be learned when we imagine that healthcare waste could be increasing all the time and the facilities for dealing with it are not. So we really need to encourage innovative ways to reduce, recycle, and even reuse plastics in healthcare. And this, we feel the treaty can do a lot to encourage this innovation to be scaled up and implemented in all countries. We're seeing very good examples in many healthcare systems around the world, but more needs to be done. But we want to say that we need to strike an important balance between adoption of innovative approaches, ensuring the equitable access to these medical products continues, and we would like to make sure that the treaty addresses this issue in a very balanced way. So I think that's the 3 points I wanted to make in the introduction. Thank you, Diana, or Damaris.
Like one person. Thank you so much, Leslie, and really great to see all the important work that is also being done by the WHO in order to raise awareness on plastic pollution and how this is also an issue for the health sector. Now we'll also hear the perspective from Melchior from IFPMA. You have the floor.
Thanks a lot. Thanks for having me. I'm quite happy to be here because I've listened to a lot of your webinars over the past months since I've been following this topic, and they've been very, very informative. Hopefully, I can contribute too this time. So I think I'd like to start by recognizing that, all of us who work in health, almost by definition, are quite sensitive to the impact of plastics, on the environment and on human health. So I think it's really important that we do find good solutions coming out of the treaty, coming out of INC 5, together with the Global Self-Care Federation and the International Generics and Biosimilars Association. We've published a statement this morning, actually, on the industry's position towards the plastics treaty. Happy to put the link in the chat or share with you, Diana, to share later on. I think I'm going to be speaking a bit more to Leslie, your third point here, which was on the key role that plastics has played in healthcare, especially for facilitating patient safety and access to medicines. I think there are a number of different examples that we may not be as familiar with because often they're not as visible to us. For example, in biopharmaceutical manufacturing, you have plastics that are used within the drugs themselves, sometimes in polymer matrices. This is to help with the dosage of the medicines, to help with controlled release and things like this. You also have within the manufacturing process itself, plastic is very, very important. We've shifted for various reasons in different countries, in different contexts, among different companies, towards using biobags and things like this. This has helped immensely with manufacturing scale up. We saw this in COVID, for example. The ability to produce a lot of medicines very quickly wouldn't really be possible with plastic technology. Again, for medical technology, Leslie mentioned a few. You have joint replacements, you have catheters, tubes to put into your heart so that you have surgery there so people can continue living, artificial corneas that go into your eye to help people see. And even when you have metallic devices inside your body, you may need a plastic coating to make sure that they're biocompatible with your body so they don't corrode and rust and things like this. I mean, that said, there is clearly a need to reduce unnecessary plastic use. Wherever we can, there's a need to cut down on it. And there's a need for different actors within the healthcare value chain to contribute to this in different ways. I can speak from the perspective of the pharmaceutical industry. There are a number of different initiatives that companies have undertaken over the years. They range from take-back schemes, which is simply, often for inhalers or injectable devices. The companies make sure that they're taken back at the end of their life cycle. There are investments into greener technologies at the moment. There's a collaboration in the EU between industry and the EU itself, looking at packaging and single-use devices. Packaging changes. Sometimes we think it might be simple to change packaging from plastic to cardboard or something like this, but it can actually be quite complicated, especially when you start thinking you need cold chain storage for certain medical products. You can't just ship them in containers without making sure they're not affected by temperature changes and things like this, where it's quite complicated to move away from plastic in certain situations. But companies have moved to more reusable methods instead of single use in this area. There have been shifts towards cardboard packaging, mainly for secondary packaging. So that's the packaging that's not in contact with the medicine itself. I mean, all of these efforts, they're undertaken in an environment which is quite complicated. The industry is quite unique in a way because the objective is to protect patient health. So we've got to make sure that the products are safe, have sufficient quality and are available at scale when needed. So this basically means that there are stringent regulations on the sector. When you want to change things, you can't simply change packaging just like that. It takes a long time. You have to run assessments. You have to check that the design, safety, quality, and performance meet the standards required of them. Changes for secondary packaging can take around 5 years. For primary packaging, it's 10 years or more. Then, as many here are probably sensitive to, we're straddling two worlds, the public health world and the environment world. And it's not, the regulations don't always line up perfectly. It would be great if they did. I heard people talking earlier about silos. I think it's important to break down those silos and make sure that the regulations talk to each other and that they work. I mean, just as a concrete example, the sector is not allowed to use secondary plastics for primary packaging. This is under FDA guidance. There are also the rules in other jurisdictions which make it extremely difficult to do that. That's because of the safety, because you can't necessarily ensure that secondary plastics meet the quality every single batch. So that's something quite concrete there. There's also the need to reform the whole value chain to make sure that the suppliers give us the alternatives at sufficient scale, because they're not always available at the scale needed. The pharmaceutical industry is just one player that uses plastics among many, and we're not the biggest one, and we can't move the market by ourselves. And then the final thing is you do have to think about what can and what can't change. I mean, I spoke about catheters. Can we really have glass catheters or metal catheters inside our bodies? It might not be technically feasible. So I think it's important to make sure that in certain situations we recognize that there may not be alternatives there. But looking at the plastics treaty and the negotiations coming up, I think it's I think, Bernardo, you said it, there's a need to deepen understanding. And I think it's really important because this is very complex. It's very, very complicated. And I hope that through a deeper understanding, through these dialogues, through further discussions, the right decisions can be come out. I think for us, some of the important things here, you know, from the examples I gave, is that the instrument does need to recognize the need for extended compliance periods to make sure that the sector can move while ensuring access to medicines, because we don't want to end up in a situation where the medicines aren't there anymore or they're restricted because of rules that have come out. And then in those limited scenarios where there really are not any feasible, safe alternatives that exist at sufficient scale and quality, I think there will need to be exemptions. And I think these things need to be harmonized at the global level. They shouldn't be left into individual countries to deal with this in different ways, because it will complicate these global supply chains and create inefficiencies there. I'd just like to, my final comment is really that, you know, the instrument is a great opportunity. It's a great opportunity to bring together the whole value chain to work together on solutions. I think it needs to be seen as a tool to incentivize change where the change is most needed and where it's most feasible. Thanks.
Thank you very much, Melchior. And we always knew that ending plastic pollution, and I think Bernardo said it, needs a systems change. It's not easy, but I think the objective is worth the efforts. So glad to see that the industry is also at the table and ready also to contribute to the discussion on how we need to reduce, because as we'll also see afterwards, it is also an issue for the health sector. And I think we really need, as you mentioned, to see where it's really needed and where we can reduce. And it's great to see that efforts are ongoing. And I think in that case, because we know that some plastic will be needed, we need to make sure that those products are safe for public health, which means increasing transparency and disclosure requirements in order to also give more confidence. And I think this is something that needs to be done with the private sector, and also point taken on the importance that also we need to align regulatory requirements. But I think this is where the treaty will need to provide the right incentives. Having said this, our third speaker to set up the scene is Sarah Dunlop from Mineral Foundation, and we look very much forward to hearing from you. Sarah, you have the floor. Sarah, you're muted. Sorry. We can't hear you.
Got it. There, is that better? There we go. Thank you.
Yeah, perfect.
Can you hear me now? Good. You could before and you can now. So, thank you, Damri, and also the Geneva Environment Network, as well as the World Health Organization, for all your work in this space. So, health needs to be strengthened in the Global Plastics Treaty for four, really very simple reasons. And the first reason is that plastic harms human health in multiple ways across the plastic life cycle. Industrial emissions include greenhouse gases, particulate air pollution, and also chemical releases from the fossil fuel extraction and plastic production itself, as well as plastic recycling and disposal. And health impacts here include multiple cancers, infertility, premature birth, cardiovascular, and lung disease. Sacrifice zones include fracking wells, petrochemical plants, and also waste dumps. And I think the point here is the massive social injustice and environmental racism. That's what it boils down to. And it's the vulnerable, low-income communities, often of color, who live and work in these places, who are harmed because of the very intense production of plastic and also the commercial sales, which is coupled with a virtual inability to manage the waste. Fracking is linked with nausea, respiratory disease, blood disorders, and cardiovascular and kidney disease. Ethane crackers with blood cancers, irregular menses, anemia, and immunosuppression, as well as preterm birth and low birth weight, which has huge impacts on children later in life. And petrochemical plants with increased risk of leukemia and lung cancer, asthma, respiratory infections, and cardiovascular disease. And during disposal, we see harms from e-waste with adverse birth outcomes and changed thyroid function. And incineration, particularly uncontrolled burning, releases a wide range of highly toxic chemicals with high exposure levels and excess cancer rates. And landfill sites are similarly experience higher carcinogenic risk. Plastic also harms health during everyday use. That's you and me, the general population, and our children. And here on the top right, we summarize harm to human health from exposure to common high volume plastic chemicals, representing, the data here represents something like 1.5 million individuals in our umbrella review. And we found evidence at this level for only the tip of the chemical iceberg, namely BPA, phthalates, flame retardants, and some of the PFAS. And the red here means consistent and statistically significant evidence for harm. We've got that evidence. Yellow is statistically significant, but with some inconsistency, but always with the effect going in the wrong direction. And so, to summarize, our ability to reproduce is impacted with reduced sperm counts and sperm damage, DNA damage in men, and endometriosis and polycystic ovarian syndrome in women. At birth, we see miscarriage, that's the right to life, and reduced birth weight. In children, loss of IQ points, that's what it is to be human, asthma, obesity, and high blood pressure. And in adults, type 2 diabetes, obesity, cardiovascular disease, and cancer. And then there's the very real threat from the gigatons of big pieces of plastic polluting the environment and shedding off products as we use them, whose only fate is to break up into smaller and smaller pieces of itself. That's the micro and the nanoplastics, which we're beginning to learn in us. But we don't know about the health effects yet. We have major concern for health consequences. Next slide, please. The second overarching reason is that health needs to be strengthened in the Global Plastics Treaty is that plastic's not cheap. It's in fact very expensive. And on the left-hand side, we see global costs from plastic production totaling just under 600 billion US from injuries as well as damage to health from particulate gas and chemical emissions. And on the right, we took another look. These are the costs in the US alone, which total 675 billion due to mortality from some of those chemicals I was just talking about. So that's mortality from the DEHP plasticizer, the phthalate plasticizer, IQ point loss from the PBDE flame retardants, and then heart disease and stroke from BPA. These are clearly underestimates because of the small number of chemicals we were able to look at, the health outcomes, and indeed the countries for which we have data. But I think the take-home message here is that it's the human health that's paying very heavily for the hidden price of plastic. If I could have the next slide, please. The third reason that health needs to be strengthened in the Global Plastics Treaty, and pretty urgently I would argue, is that all of the harms to health that I've just summarised and their costs will only worsen considerably as production continues to soar. And the fourth reason, I think, is that even if we don't think we should strengthen the treaty for ourselves, we must do it for our children and our grandchildren. We must have a strong and legally binding treaty to protect those small beings which are just coming into the world. They're highly vulnerable and they have absolutely no choice about plastic exposure from in utero onwards, in fact, from before conception, nor the health impacts that they're going to endure throughout their lives. And I leave you with the image on the bottom left. And when I saw it, the thing that sprung into my mind is, what's wrong with this picture? Well, the baby is totally surrounded by plastic. And I think when I first looked at it, and I still think it, that the baby itself also looks a bit worried. So thank you very much indeed.
Thank you very much, Sarah, also for not sparing us from this kind of distressing reality about what is plastic and also the cost for human health and for society as a whole. We'll probably have, and I hope we'll have the time at the end for some questions, including from this first panel. But I would suggest that after this really important setting the scene, we also move to our concrete case. And we have the privilege to have with us Ludwig Albornoz, who is head of the Department of Pathology and Laboratory Medicine from Fundación Valle del Lili from Colombia. And we look very much to hearing from you.
Thank you very much, Diana, and I appreciate the invitation. Very happy to be here. My name is Ludwig Albornoz. I'm an anatomic and clinical pathologist. I work and live in Cali, Colombia. Our city hosted the last biodiversity COP16. We're very happy and proud to be the only hospital invited in this event. And as you may see, our hospital is imbued in nature. Next, please. So can we have a plastic-free healthcare feasible? Is it viable? I will address the third guiding principle of WHO that Leslie put forward regarding our role as a consumer, as a responsible, prudent user of plastic from the healthcare sector. Our case study in reducing plastic use in the hospital setting will come next. Thank you. Next. So I'll address first context, secondly strategies, and lastly results. Next, please. As far as context, we are a university academic hospital organization with two hospitalization venues and others that are ambulatory only, just under 800 beds with this activity as far as hospital activity and discharging, ER, outpatient, and human resources. Placed in Cali, Colombia, as you know, on the uppermost northwestern corner of South America. Next. I don't pretend to go through the whole slide. I just want to mention that for our safe and patient-centered healthcare, we need to balance operational and clinical practice, operational activities dealing predominantly by pharmacy and sterilization and laundry, other operational support, and some items that are provided directly to patients or indirectly have to do with patient care. So this is the inventory of plastics in our place. Strategies now. Next, please. We have a distinct criteria for approach, which include procurement, coherence and adherence to organizational-wide policies, education, inspections, which are active activities, environmental safety events, which are reactive rather than proactive, and some metrics that we will show. Next, please. As far as the procurement strategy, we need it to be sustainable in our hospital network by avoiding restricted substances list as chemical agents, as well as choosing substitutes, for example, for latex, prioritizing efficient products, favoring reusable packaging of our products, prioritizing local or regional whenever feasible, avoiding non-woven fabric, preferring reusable and re-sterilizable over other options, and supporting brands that have a traceable trajectory. Next, please. As far as results, we will show the following. Next. I apologize. On the left-hand side is only in Spanish, so I'll simply mention that we have surgical suites that are considered green because we reprocess medical devices and we change from disposable to reusable, such as, for example, staple removers and trocars, which is a type of catheter we can use in abdominal surgery, as shown at the right. To the right of the slide, how it was before and how it is now, where we replaced with stainless steel trocars, and we'll show the numbers later. It went up to 7.2 tons that were avoided as far as residue in our 5-year period. Next, please. As what has to do with face masks used in anesthesia and other procedures, we had a savings that can go up to over 200,000 units over the 5-year period of our strategy so far, with savings in this amount of money, almost $300,000, and a savings of solid waste disposal over 5 years of over 4.7 tons, because we do not use any more PVC DHP face masks, but rather PVC-free silicone reusable, which are pasteurized once utilized, not sterilized, and it is sufficient for our infection control, as far as we can tell by our measurements, and with a life cycle that can be reused over 20 up to 100 times. And at the end of the life cycle, these non-PVC silicone masks are pelleted for recycling. Next, please. Another example has to do with reusable trocars. Instead of the old type of trocars used in abdominal surgery, for the stainless steel re-sterilizable reusable, in which we used and saved almost 41,000 units over the 5-year period, with over $3.2 million in money savings and a savings in solid waste disposal of over 5 tons. These trocars are used in abdominal surgery, and now we don't use the single-use disposable, rather. Next, please. And other greener and cost-effective results. We go green, and it does not have to be more costly. That is one of the main lessons learned in our hospitals. In areas, I will not read all this, but it amounts to over 161 tons per year saved in solid waste from the laundry service, labs, sterilization service, pharmacy, the hospital wards, and the surgical suites. Next. And lastly, I want to share that our indicator of solid waste residue, which is currently 0.6 kilos per bed per day, is way below the published reference value that is in this paper published by these authors, and can be consulted using this QR code from the Europe and Latin American groups. Next, please. So from Cali, Colombia, hosting the last Biodiversity COP16, I do thank you and are available for questions.
Thank you very much. And I think it's really a privilege to have your perspective here. And I think your results are impressive, and I hope they will inspire many other around the world. And I think this is also very important for plastic treaty negotiator, because I have to say, as I was one of them, we always had the impression that at first we thought that the health sector needed some sort of a blanket exemptions, because it was not possible. It was one of these sectors where we could not do anything. But I think through this example, and of course many more, and many things were already said this afternoon, it is really possible, and there's a real will also from many in the health sector, and it's good for the environment, it's good for human health, and as you mentioned, financially, it has also its benefits. So thank you very much for sharing this with us this afternoon. I suggest we now move to our second panel, who will also tell us a bit more, because now we are really entering the final phase of the negotiation. So what is it we can do concretely, and what should a negotiator agree to in Busan very soon? And for this, we have a number of speakers, and we will start first with healthcare without harm. And we have the privilege of having Rico Euripidu with us now. You have the floor.
Good afternoon to all, and thank you to the Geneva Environmental Network for hosting this important topic. Healthcare Without Harm is now a 25-year-old NGO that works to transform the healthcare sector globally so that we understand and reduce its environmental footprint, and that the healthcare sector can also become an anchor for sustainability and also a leader in the global movement for environmental health and environmental justice. And within this network, we maintain a global green and healthy hospital network, and Ludwig's Hospital is a member of that network and a beacon of success in the network. And in this membership, we have currently 2,030 odd members, and they are located in 86 countries, representing over 70,000 hospitals and healthcare sectors. So we have a global footprint working with the healthcare sector. Next slide, please. Globally, healthcare facilities contribute up to 16 million tons of waste annually. And over a third of that, approximately 6 million tons of this is plastics waste. In the US, in US healthcare facilities, 14,000 tons of waste is generated daily. And of that, between 20 to 25% is plastics. However, depending on the region, it differs quite a bit. In waste audits that we conducted in Africa, we found that up to 75% of hospital waste is general plastic waste, and most of it is non-essential single-use plastic. Of that, at least 80% could have been recycled, and yet over 90% of that plastic either ended up in a landfill site or was incinerated or leaked into the environment. And that is consistent with the global norm, that less than 10% of plastics ever produced have ever been recycled. And it flies in the face of the idea that we can recycle our way out of the plastics crisis. During COVID, in year one, 8.4 million metric tons of mismanaged plastic waste was generated globally. And at least 25,000 tons of that leaked into the global oceans alone. Next slide, please. So this is part of the problem, that the global medical plastics market is projected to increase from $26 to $41 billion over the next 5 years, representing a 10% compound annual growth rate. And this explosive growth is driven primarily by the demand for single-use medical devices. PVC, the most problematic of plastics, is still the most widely used medical plastics. And PVC and its health and environmental impacts have been documented for over the last 20 years, not just in the healthcare sector, but in occupational health settings, in production settings, and many other settings. And part of what's driving the increase is this perception that they can improve infection prevention, infection control. And we are currently seeing that medical experts, healthcare professionals are starting to challenge that idea. And we are beginning to see peer-reviewed evidence in the medical literature in this respect. Next slide, please. Healthcare Without Harm and our partners have created toolkits and written reports and provided global challenges and awards that provide a roadmap for health systems that want to take action and that want to detoxify plastics within their facilities. One of the case studies is the one that has been presented. And we have case studies that are suitable for all kinds and sizes of health facilities. So if you are a negotiator at the Plastics INC and you want to know whether or not hospitals are taking action and are addressing plastics in their healthcare settings, it's very likely that in the 85 countries where we have Global Green and Healthy Hospital members, that we will be able to provide you with the evidence that some of those healthcare providers are taking action to reduce, to detoxify, that are innovating, whether it's a high volume product, and whether they know how to redesign or reduce or reuse. There are examples that fit all of these scenarios. Next slide, please. And this is the most telling. This is the most, for us, the most telling evidence that we have to hand that the healthcare sector is saying that plastics, and in particular single-use plastics, are non-essential in healthcare, and that there should be no blanket bans for plastics in healthcare. We are leading this effort to bring to the attention of the healthcare sector this open letter that has been signed, which urges the participants of the Plastics Treaty that it's not an essential use in healthcare. And to date, the letter has been signed by groups and individuals that represent over 18 million health professionals globally from 75 countries. And if you want to find that letter, you can find it on our website. So thank you very much for your attention. And the message is that plastics, the idea that plastics are essential in healthcare, has been challenged, and that single-use plastics in particular are non-essential uses. Thank you so much for your attention.
Thank you very much, Rico, and also thank you very much for the leadership and all the efforts. And I think your points were very clear also on what needs to concretely be done in a few weeks in Busan. So thank you very much for this. And now we have the pleasure also to hear from Albert Magalang from the Philippines, who's also one of the negotiators in the plastic treaty, and Philippines has also been a strong advocate for an ambitious treaty to end plastic pollution. We're very happy to have you with us. You have the floor, sir.
Thank you so much. And from Baku, Azerbaijan, I'm also attending the COP29. A pleasant afternoon, and it's my pleasure once again for the Philippines to be invited once again in this dialogue, especially as we prepare for INC 5. So I would like to discuss or present briefly some points which would strengthen somehow the health aspects of the future plastics treaty. So I don't have any presentation, but I would just narrate what we have prepared as part of our position in INC 5. And we believe that the fifth and final round of negotiations, which is INC 5, is the decisive moment to protect human health and nature from plastic pollution. So the Philippines joins the member states that support for a possible phase out or reduction of chemicals and polymers of concerns based on the UNEA Resolution 5/14, which reaffirms the importance of preventing the risks to human health and well-being and of the environment due to plastic pollution. So we have already presented this in our positions that based on scientific report, it was identified that over 16,000 chemicals added to plastics are reported in the latest scientific report. So of the 16,000 plus chemicals, only 980 hazardous chemicals are regulated by international treaties such as the Stockholm Convention, while an additional 4,200 chemicals are not globally regulated but have known hazards such as causing cancers, genetic mutations, or harm to the reproductive system. Furthermore, about 10,000 chemicals used in plastics have no hazard data. So at INC 5, member states must secure approved treaty texts on the elimination of harmful plastics that should also include provisions to ban and phase out the most harmful plastic products and chemicals of concern. Secondly, the global lists and criteria for identification of plastic products and chemicals of concern to be banned and phased out should be presented, starting with those most harmful to human health and the environment and feasible for elimination. The initial lists at INC 5 must prioritize the products and chemicals that are most harmful to human health and the environment and are already avoidable to ensure immediate global action in the areas of greatest harm. Initial lists likewise, as well as the criteria, should provide the necessary basis for immediate action on the most critical matters and for future improvements of the treaty. High level and general criteria that will be approved at the INC 5 could be further elaborated through deliberations by relevant subsidiary bodies and the conference of the parties to include supplementary technical indicators and additional details. So as evidence grows on the potential harms and risks of specific plastics to human health and the environment, the assessment of plastics and chemicals against the criteria would inform necessary improvements of the treaty's measures and additional harmful plastics to be subjected to global bans. So there would be a combined list and criteria approach that will ensure states or member states that can take both immediate action and scale up their efforts to address harmful products and chemicals over time. So talking about the high-level criteria that will identify plastic products to be subject to global bans and phase-outs, this would include those with high probability or likelihood of ending in the environment in their entirety or in parts maybe, or in products or in byproducts, and also in emissions and releases during their life cycle, and those also with high elimination feasibility that would also consider technical and socioeconomic and environmental aspects. So further on the criteria, which we would like to see a high level kind of a criteria on chemicals contained in plastic products. This should be subject to global bans and phase out. Potential for adverse impacts on human health and environment should be stressed, and also the criteria to assess a chemical's level of concern, like for example, persistence or long-term presence of chemicals in air, water, soil, and organisms. Bioaccumulation is also one, which would refer to the potential of a chemical to stay and accumulate in living organisms. Mobility, next, which would refer to the potential of a chemical to spread in the environment. And lastly, toxicity, which would refer to the potential of a chemical to cause harm to living organisms. So the approved text which we are expecting at INC 5 must also include a provision that would stipulate a legally binding obligation for each party to ban and phase out plastic products containing chemicals of concerns. So the evidence on the adverse effects of certain plastic chemicals and polymers on human health and environment, such as the report of the United Nations Environment Program and Secretariat of the Basel, Rotterdam, and Stockholm Conventions, and findings by the Monaco Commissions on Plastics and Human Health, will highlight the urgent need to address these substances. That's all, colleagues. Thank you for your attention.
Thank you very much, Albert, for also highlighting a concrete way forward and priorities areas for the Philippines and hopefully for other countries on how to clean the plastic economy and what needs to be done in what sequence. We wish you best of luck, of course, for your climate negotiation. We know that plastic crisis, health crisis, climate crisis are all intertwined, and we count also on your leadership in Baku. Best of luck, and thank you very much for being with us. Now we have also Yuyun Ismawati, who's Senior Advisor and Co-founder of the Nexus for Health, Environment and Development Foundation, and also co-chair of IPEN, to share some perspective with us on what needs to be included in the plastic treaty. You have the floor.
Thank you. Thank you for having me in this webinar. I would like to add into several points that have already raised by previous speakers. First, I would like to introduce IPEN's website addressing the toxic plastics. You can go to that link and access many reports and also information. Next slide, please. I'd like to go to this map, introduce you to this map where you can find about 137 reports where IPEN participating organizations around the world are conducting studies related to plastics from the upstream level to middle stream to downstream, specifically addressing and looking at chemicals in plastics that are already released to the environment and can be detected. And this is all done as an original studies, authentic studies found on the ground and submitted to governments in every country where the study conducted as recommendations to improve regulations and policy. The next slide, please. And to provide recommendations for actions need to be done to address the issue, to strengthen the plastic treaty. I echoed previous speakers that looking for or pushing for the global agreement and legally binding. Globally, not looking at the national level too much, but it has to be legally binding and globally bind. And this treaty have to be applied and adopted with global agreement, because countries cannot solve their own problems. And then the second, there is a strong need to come into agreement to control and reduce the plastic production. We have overproduction right now. It's not mismanagement only, but it's overproduction. There are many facilities now actually idle their capacities because the demand for certain type of plastics already declining. So this is the good opportunity to discuss which type of plastic can be reduced with certain targets of sunset dates or time bound. And then the volume have to be reduced to a certain level. The EU proposed to cut the production to 40%, but some petrochemical countries might disagree with this, but there should be an agreement to cut down the production by 2040. And then the third action need to be done is the important part of this treaty is the elimination of toxic chemicals used in plastics throughout the whole life cycle. Many speakers already addressed these issues, and chemicals of concerns need to be regulated throughout the whole process, including looking for safer alternatives, because we cannot only eliminate this without replacing it with the new one. But also, there are strong needs to have disclosures from industry and not keeping chemicals as secret ingredients of industry, because once they get out of the environment or released to the environment, we will know what's in it. But there is a strong need to have commitment also and good faith from the industry to disclose what kind of chemicals that they use. Next slide, please. The circular economy has been proposed and promoted over and over again without considering the chemical content in those products. So we don't want to have only circular economy, but we would like to see more toxics-free circular economy, where those chemicals that are harmful and toxic will not be accumulated in the next products. So we have to have a strong agreement to ban the recycling of plastics containing hazardous chemicals. And this can be easily done by following several reports and research and studies already done by many scientists, including the discussions at the intersessional work. Identified already the chemicals of concern with the criteria and non-criteria and so on. That should be discussed at the plastic negotiation in Busan. And we would like to see also there will be no children products. Colleagues from Packaging Forum just released a study about the leak or the migration of chemicals in children's reusable bottles, drinking bottles, that are already detected. And in IPEN studies also, we found a lot of chemicals, harmful chemicals in high concentrations in children products and kitchen utensils. So we don't want to see this repeated over and over again, because many countries also propose the higher recycled content in the recycled products. This is dangerous. We don't want to see that. And then another important things to be done is to increase the capacity of the health sector. Based on my observations in many developing countries, and we can see it also at the plastic treaty negotiations, only a handful delegations send their representatives from the Ministry of Health. And then when we talk to the Ministry of Health in the country, they do not have the knowledge or sufficient capacity to understand the link between chemicals of concern and health and non-communicable diseases. So I see this is the important point to increase the literacy on chemicals and waste in health sector. And then there in one of the questions I saw someone address the issue of cancer because she's a cancer patient. And this is another link to non-communicable diseases. We've seen a lot of cancer cases already. I myself also have one. And we don't want the medical professionals only recognize the disease without knowing the causality or the correlations with the exposures to chemicals. And in the International Code of Diseases, it's important to highlight the correlations between chemicals of concern and also the need to increase the methodology for biomonitoring. There are many methodologies now to measure chemicals in our body, blood prick or using wristband that need to be promoted more. So it will be affordable and accessible. And lastly, transparency and traceability of chemicals in all value chains are needed. And this is, we need not only a strong political pressure for this and political support, but also the willingness for the industry to open up and disclose their secret ingredients. It's not secret anymore if everyone gets sick. And we don't want to see a sustainable plastic production, and we don't want to see sustainable cancer. So it's important to have a transparency pollution control following TRI or PRTR that have already implemented in many countries. And everyone have to be transparent in this. That will also help the recyclers to do their job. So lastly, I just want to close, next slide, my interventions by addressing and highlighting that the treaty must have a meaningful global control measures to protect human health and the environment. Otherwise, it will be a meaningless treaty. Thank you so much.
Thank you very much, Yoon, for this very insightful presentation and also for all the work IPEN is doing. I think a point taken that Ministry of Health needs also to be more involved, and that we need to make sure also that measures to protect the environment will not be also detrimental to health. And I think this is also one of the reasons why the involvement of the health sector is so much needed. And Leslie has also made, through her organization, WHO, but also personally, very committed to ensuring that Ministry of Health are more included. She will also be at Inc. 5 ready also to support the delegation that needed. So very happy to have you with us and to share some of your wisdom also on the plastic treaty.
Well, I think that, thank you, Damaris. I think that we've heard quite a lot of wisdom in the room already, so I'm not sure I could add a lot to that. I think there were a lot of commonality coming from the speakers already. I think I just want to take us back to the beginning part of the meeting where we talked about the negotiations coming to a close and the documents that we would have to work with at INC 5. And we have a compilation text, but we also have now a very interesting co-chair's paper setting out a more simplified approach. So I think that there's both the detail that's in the compilation text and also this more streamlined way of looking at things, which helps us to put things in a better perspective. And WHO certainly appreciates this co-chair's paper. I just want to touch on 3 aspects where we think that, in addition to what we've heard of already, first of all, I think the preamble of the text, there's still quite a lot of room to improve in that preamble, the references to health, and particularly the obligation to safeguard human rights, particularly in relation to health and a clean, healthy and sustainable environment. But also the treaty needs to recognise the adverse health effects, not only health concerns, and that certain groups are disproportionately affected. So we would like to also see some reference to the need to prioritise environmental protection, human health and human rights above vested interests, which have been alluded to this afternoon in terms of increased production and so on. We'd like to advocate also for a sectoral approach for the use of plastics in healthcare. We've heard about the size of and complexity of the use of plastics and the need to build in synergies with the existing normative guidance and governance mechanisms, the need to raise awareness. So I think there needs to be a specific scope or space in the treaty to allow the time that's needed to realize these innovations and to build in the necessary safeguards. So certainly, fundamentally, we don't want to see any blanket exemptions for any health reason or for any other category of products. We'd rather see the treaty being really incentivizing the innovation that's needed. So I just really want to leave with that main thought. Thank you.
Thank you very much, Leslie. I think there was a number of also questions in the chat, but I think thanks to the agility and wonderful team from Jen, I think a number of response reports, etc., could be shared. Also encourage all colleagues and interested persons to always go to the Jen website. It's a wonderful places for resources. So I think you will find much more material. So I didn't really see any pressing questions online, but I would also want to see if someone in the room had any question for our panelists. It doesn't seem to be the case. So I just wanted to see if any of the speakers and had any kind of last recommendations for the negotiators at INC 5. And I don't know if, for example, Melchior, you also wanted to share some perspective, or Sarah, if you're still online, Ludwig, Rico, Yuyun, if you wanted to share some thoughts. Do we want to start with you, Sarah? If you had one last recommendations for the negotiator.
Thank you. Yes, I mean, I've been listening, and we're all talking to the converted, and you know, I think the why, the first part that we tackled today, is so obvious. We can see the harm from multiple different angles, not just health, but all the other impacts as well. It's the how, and to me, if I need to be brutally honest here, it seems to me that vested interests are driving, maintain the status quo, and I can't. We need to figure out how to cut across that so that everyone benefits. I mean, we would be a much healthier, wealthier world if we got this right. We really would. It's not. I'm not offering any recommendations or solutions. It's a sort of a philosophical overview about really that we need to do this. And I think there'll be benefits. There will be benefits for all of this, all of us, if we get this right, when we get this right.
Thank you very much, Sarah. I see that Ludwig had also turned his camera. Would you want to say also some few words?
Brief reflection. From the standpoint of a physician dedicated to laboratory medicine and pathology within a hospital setting, seeing the burden of disease and the way we do things, business as usual, is unsustainable. And there's the need for us in the health sector to be considered as part of the solution, and to avoid the artificial distinction of human health as something separate to global health. Lastly, I'd like to say that whenever in the future people will live in planetary colonies in other places, or those that live in, for example, research centers in Antarctica, or the ISS in orbit, or even a submarine, they know how the environment affects the health of people and about sustainability as something that is crucial. Thank you.
Thank you so much, Ludwig. And Rico, would you now want to share your last words?
Thank you, Damaris. I have one simple message to especially all the negotiators on this call. Listen to the voices of healthcare professionals. Listen to what they are saying. Read the open letter that is addressed specifically to you. Healthcare workers are the most trusted voices in our society. People listen to doctors and to nurses when they speak. So we have an imperative to also listen to their voices. So read their letter and listen to what they are saying. Thank you.
Thank you so much, Rico. Melchior?
Thanks a lot. I think on a really positive note, I think it's really important that we do incentivize changes among the whole among the healthcare sector, but globally across all sectors. And I think we can help drive it through this plastics treaty. I think it's important that when we focus on change, or when we focus on trying to shift things, there are alternatives to move to. I think it's really important to make sure that there is a smooth transition in that way. Yeah, just a short word.
Thank you very much. Yuyun, and then we'll have Albert. Yuyun, you have the floor.
Thank you, Mr. Colonel. I think it's very important for negotiators to consider health aspects in every article and not putting health article at the bottom. I hate to see it in Article 19 or 16. It has to be on top and above, because that should be close to the production article as well as the chemicals of concern. Then health should be followed and not at the bottom. And I would like to see more of the health aspects also mentioned in the negotiations, especially to highlight the importance of harmful effects of recycled plastics, and also the emissions and releases, not only the microplastics or nanoplastics, but also the chemicals in the productions processes. So all in all, I hope and wish that health issues will be stronger, have a stronger words at the INC 5, and I hope delegates listen to the science. Thank you.
Thank you very much, Yuyun, and take good care also of yourself. And now, Albert, do you want to share us some of your wisdom? You're muted, Albert.
Sorry for that. The room is now becoming noisier. Anyway, as I do agree, and I take this as a challenge for negotiators to put forward the concern on health, and it should appear in the text of the treaty. And in fact, we have already started discussions on the inclusion of health, and now we would like to push forward more aggressively that the approved text should highlight elimination of harmful plastics. I've already mentioned this, but we have to stress that and push harder for the inclusion of the provisions to ban and phase out the most harmful plastic products and chemicals. And also, there's an opportunity now for member states to work on the global lists and criteria for identification of plastic products and chemicals of concern that should be banned and phased out. So, so far, these are the two major, entry points for the treaty text that could make way for the concerns on health, particularly on how to eliminate harmful plastics that could cause harm to the human health and the environment. Thank you, colleagues.
Thank you very much, Albert. We have one request for the floor from the room. Before or two. So Camelia, you have the floor first.
Okay, thank you very much. And I have 1 minute. We'll actually comply with this. So we spoke about health aspects of the future plastic treaty, but for this and for all the aspects, I think you need the local and subnational government. So I am here today on behalf of the local and subnational governments coalition to end plastic pollution to present once again the deep commitment of cities and regions worldwide to support the adoption of a strong treaty, including, of course, the health aspects. So local governments are the unusual stakeholders, and while they are part of the whole of government, so please include whole of government in the treaty pyramid, they typically have less decision-making power and fewer resources than central governments. So yet, when it comes to plastic pollution, again, even in health aspects and healthcare, you need local and regional governments to implement all the solutions that can be found to improve the world situation in this aspect. So there is everyone interest to support the full inclusion of local and subnational governments in the treaty. Without their involvement, this treaty risks to becoming a dead letter, being very ambitious, but having a limited on the ground impact. Therefore, we have submitted a letter
my daughter, who 2 years ago wrote a petition to states calling for this treaty. And I think much was said about the fact that we need to engage in these negotiations, but also many other negotiations, such as the pandemic treaty negotiations and many others, with a viewpoint of what the children of today, but also the next generations would think of us in terms of what is it that we are delivering for this important negotiation. So I wish you all success and stand ready to support for Busan and moving onwards. Thank you.
Thank you very much for this, and also congratulations to your wonderful daughter, also for taking action. I think there's now, I think the negotiator heard it loud and clear. There is an opportunity to make now history in Busan for the system change that we need also for the next generation. We know that individuality, personality, personal engagement will matter in this negotiation. I hope all involved will not be afraid to be ambitious. There is a mandate. The treaty needs to fulfill the objective of ending plastic pollution. Otherwise, it is not worth it. So I think now all eyes on Busan. I'm not wishing luck. I think it's going to be hard work. You need to push for ambition. I think people all over the world are ready for this system change. So we now need action. And I'm very happy that now Bernardo has also entered the room. And I know that his positivity hard work will also accompany the negotiator in Busan, and we look very much for an outcome with an ambitious treaty that will really provide for this system change that we need. Thank you very much, Jen, and all the participants online. We need to continue to fight the good fights, and we will do so with all relevant actors in the treaty making process and beyond. Thank you very much.
Thank you.